Splenic infarction. Splenic infarction is a result of ischemia to the spleen, and in many cases requires no treatment. Splenic infarcts can occur due to a number of processes, involving either arterial supply, the spleen itself, or the venous drainage. Patients with a splenic infarction may present with left upper quadrant pain. 40% of patients with splenic infarction are asymptomatic. Etiologies are hematologic disorders, more common in younger patients. Example: sickle cell disease, hypercoagulable states, factor V Leiden, embolic events, more common in older patients, infective endocarditis and marantic endocarditis. Splenic vascular disease, granulomatosis with polyangiitis, splenic arterial aneurysms, variant anatomy, example wandering spleen, which may undergo splenic torsion. Collagen vascular disease, pancreatitis, non-hematologic malignancies, blunt trauma. A segmental splenic infarct can occur as a rare complication. Splenic artery compression, example by pancreatic tumor. Splenic embolization, leukemia, CML most common. Orca disease. Both ultrasound and CT are sensitive to the diagnosis. In the hyperacute setting, CT with contrast is the modality of choice if the diagnosis is suspected. Morphologically, the typical infarct is of a pyramidal wedge of affected splenic tissue with the apex pointing towards the hilum, and the base on the splenic capsule. Ultrasound. Typically, infarcts are hypoechoic compared to the rest of the spleen, although acutely they can be isoechoic and hard to identify. The bright band sign can be seen within infarct lesions. Sonographic features of acute splenic infarcts regarding shape can vary and include wedge-shaped, classic; round, irregularly; smooth, uncommon. During contrast-enhanced ultrasound, the infarcted area remains hypointense throughout all phases of the study. As the infarct matures, if it undergoes contraction and scarring, it will appear as a hyperechoic region with retraction of the capsule. If liquefaction occurs, the area may be rounded and anechoic, like splenic pseudocyst.